We'll give everyone just a moment to get logged on.
Mhm.
Okay. Good afternoon, everyone. Thank you all for joining our BUCSAFE Town Hall today. Before we officially get started and Dr. Costin kicks us off, please remember that this webinar will be recorded. Please also note that you can ask a question at any time during the presentation by clicking the Q&A box at the very bottom. Refrain from using our chat system unless it's a personal question, but the Q&A box is for everyone to see, so we can answer that for everyone. We will address the questions either by answering through written text in the Q&A, or some of our panelists may choose to speak about it during the presentation. We will do our best to answer what we can in our allotted time today, and we will be sure to add any new questions and answers to our BUCSAFE FAQ on our website. So with that, I'll hand it over to President Costin.
Thank you, Jenna. I appreciate it. I appreciate all of you parents and students of being here today. You know, we are doing this and we didn't expect to be doing this, quite frankly, because, you know, we've been at this COVID thing for now 17 months. And I don't know about all of you, but I had a glorious summer, because the glorious summer was mostly mask free. I mean, it was like I'd come into a whole new world, and our full intent, based on the data, based on how things appeared to be going, was that we were at the very worst, if I could use the term, we're going to be mask optional in the semester. And that was true until probably about 3 weeks ago. As I won't bore you with all the details, but I have been meeting with what we call the University Pandemic Task Force. I'll introduce them to you here in just a second, but I've been meeting with them just about weekly now for close to the 17 months of the pandemic. And so what the faculty and staff and this task force did last year, last March of 2020, we sort of turned on a dime to make sure that education could continue. And, you know, we were one of the first universities back in June of 2020 to say, you know, we're going to go face to face. We're going to figure it out. We're going to do it, have face-to-face classes in a way that makes sure that students have the opportunity to have the best possible college experience that they can have. And of course, you know, in the middle of a pandemic, you know, there are and have been and will continue to be challenges from time to time. But our commitment to you as parents and students is that we are going to balance as best we can, based on the best data we have, based on the big God that we have, based on our commitment to do the hard things necessary to get the job done. We're going to do the things necessary to balance both the health and safety of faculty, staff, and students, who for us and for all you parents are the most important people in the equation, but also to balance the mission that we have to make sure that we can stay in school for the entire semester. That is our goal. Now, along the way, we will also not be afraid to adjust course as necessary. And so I know that some of the protocols that have been put into place, you know, what we've discovered in 17 months is not everybody is happy with whatever we do. And if there are people who are a little more focused on health and safety, and others who are a little more focused on getting the mission done and the expression of personal freedom and all of that. And so what we are in the position of is having to not just worry about a single individual. Our obligation, our responsibility is to do the best job that we can do to account for the health and safety and the mission of 4,000 individuals, all of whom have families, all of whom have churches, all of whom have considerations that you know, sort of span the gamut. So I say all that just to say this: our purpose today is to present the data, present some of the protocols to answer questions that we have learned, the frequently asked questions. We'll talk about some of those. And then to open up the floor for any of you to ask questions. No question is off the table. We will be as transparent as possible. In fact, now what we did all of last year and we'll do again this year, every Wednesday, certainly by the close of business, but certainly what we try to do is by noon, we send campus-wide a dashboard, if you will, of numbers of COVID cases on our campus, and any mitigation factors that we think we need to do. What we certainly hope happens is that, this Delta variant sort of snuck up on us. And what we think is going to happen is it's going to be just a few weeks of a little bit of pain, but taking some extra mitigating precautions. But we hope that certainly in just a few weeks, we'll be able to relax those and get back to the semester that we thought we were going to have even right now. The bottom line is this task force is doing the best possible job that we can do to make sure, again, that we balance health and safety with accomplishing the mission of the university, which is to prepare servant leaders to pursue significant lives. We do that by producing academic excellence in a Christian environment as we help our students integrate faith in learning, leading, and serving. So that's what really this is all about. And so it's going to be a great semester one way or the other because of our faith and trust in the Lord. And so you'll see on your screen there, this is the pandemic task force. They put my picture on there, but I'm not really part of the task force. They do all the work. We engage questions along the way. And trust me when I tell you, we have vigorous conversations about how best to balance health and safety with personal freedom and accomplishing the mission that we've been called to do. Dr. Jackie Fish is the Vice President for Academic Affairs. But she's also a nationally renowned, that's not an overstatement, a nationally renowned emergency and disaster preparedness planner. And so she has led this team remarkably well, in addition to all the other things that she has to do. On the team also, you'll hear from today, Dr. Michael Shipe. He's the person I call the data dude. He's deep into the data. He understands the scientific studies. And so he's the guy that we rely upon for that. Dr. Laurel Glover, trust me, if there's any job in the universe you do not want, it's Dr. Laurel Glover's job, because in addition to being a public health professor here on our campus, she's also the infection control coordinator. I don't know what the official title is now, but that's what she's doing. And so she's the one who probably has gotten the lowest amount of sleep per capita of anybody you have met recently, certainly in the past 17 months. And so she's the one that you will engage with often, your students will engage with, and you'll get to hear from her today as well. Dr. Gabby Poole is not able to be with us today because of another obligation, but she is the director of our physician assistant program and has sort of been in addition to Dr. Fish, kind of the co-leader, maybe the deputy leader of the pandemic task force. And so that's what that's about. Next slide, please. This was the charter of this task force. From the very beginning, our job has been to do, as I've said, to bring the faculty, staff, and students back to the campus as safely as possible so that we can get the mission done that we've been called to do. Next slide, please. So before Dr. Shipe does this thing, I'd like to kind of close my remarks by opening us in prayer. Let's do that. Father, we thank you for who you are, for loving us, for the opportunities that you've given us at this university, which is a platform for the propagation of the gospel. God, we stand here unapologetically as a decisively Christian university, doing what you've called us to do. God, you've called us to act in faith and not in fear, but you've also called us not to presume upon providence. And so, God, we're grateful for the science and the medical professionals that you've given us. We thank you also for the critical thinking abilities that you've given us, that we operate through the lens of faith to accomplish the purposes that you've given us to do, both as sons and daughters of the Most High God, but also sons and daughters of the Most High God who've been called here for a mission. And that mission really is discipling young men and women as students at Charleston Southern so they can become the men and women that you have created them and called them to be. God, we pray you'd be with us today as our conversation ensues, that you be glorified and questions would be answered. God, we thank you for this semester that's about to come, because we know, among other things, that you have put us in a place where we can learn to trust you even more. Thank you for that opportunity. In Jesus' name we pray. Amen. Okay, Dr. Shipe, over to you.
Thank you, Dr. Costin. And to echo Dr. Costin's remarks, we certainly try to portray as much transparency as possible. Unfortunately, that's also manifested by my hairline. But here we go. We are now looking at the cases, of course, have increased exponentially as we are dealing with Delta, which is what we would refer to having a much greater ability to transmit itself. Once it's in the body, it can bind more readily to our cells. And it also shows greater fitness and that it can stay around longer, which unfortunately leads to greater viral loads in those individuals and a greater ability for them to transmit the virus. So although now we're looking at the cases that are about 55% of the peak, which we experienced in January nationwide, the hospitalizations are already at 60%, while fortunately, the fatalities only reside at about 20%. Now, of course, we know that when new cases are presented, it takes about 18 to 24 days before those are manifested in the fatalities. But fortunately, the levels are certainly going to be much lower than what we experienced in January, which is underlining how effective the vaccines are. So people question, well, should I get the vaccine because I hear people who are becoming infected? Yes, there is a chance you can become infected, but if you do, when you have the vaccine, you are much less likely to have severe symptoms, to be hospitalized, or to experience a fatality in that regard. Next slide, please. Now, what we're really looking at is the pandemic is raging in the South, and especially we have a higher unvaccinated rate in the southern states, and the research bears that out is in that where we have the states with the lowest vaccination, we have the highest number of infections, the highest number of hospitalizations, and the highest number of fatalities. Keep in mind that 3 and 4 states in the South now make up almost 55 to 60% of the new cases, and that the hospitalizations have been exceeded for the peak in January in Louisiana, in Florida. Arkansas will in a couple of days, and Alabama will follow suit in kind. So we want to make certain that that doesn't take place in South Carolina as well. Next slide, please. So this is now looking at locally at South Carolina, what is taking place. The cases similar to the national level, around 57 to 60% of its peak. The hospitalizations are higher than the average, around 71%, yet the fatalities are very close at 16%. But we are still, as we are trying to manage this pandemic effectively, we have to employ the tools that we know will result in our greatest ability to keep the number of cases and hospitalizations down. That's wearing masks and encouraging vaccinations. Next slide, please. And so we can look here and look at the data for individuals who are vaccinated versus non-vaccinated. And so essentially, if you're looking at this as a report card, hey, you've got a solid B+ for the in terms of the ability of the vaccination to prevent the infections at 88%, not necessarily as high for the hospitalizations and deaths, but still remarkably effective. Keep in mind that the mRNA vaccines were designed in a short period of time, but have been proven over the last 6 to 8 months to be incredibly effective. No vaccine designed in that period of time has been effective as this one. And I know some people have reservations about the vaccine is that it was developed so quickly, but our ability now for science to move forward is much faster than it ever has been for any pandemic we've ever experienced. And although it may seem like it's happening on a compressed timeline, it is also the greatest number of experts sharing the most information in a almost simultaneous fashion that has helped us come up with these vaccines that have been remarkably effective. But you should also keep in mind that it doesn't mean that you are sterilized, you have sterilized immunity too. Just because you have the vaccination, you still are encouraged to wear a mask, although your risks are much lower because you want to protect others that you don't know their if they're immunocompromised or they haven't received vaccinations. Next slide. And this is to give us an idea of what's happening on campus. So this has been tracked over the last 2 weeks. You can see there's approximately 60 individuals, either staff, faculty, or employees that are either in isolation or quarantine. So these numbers have started to go up recently. We expect them fully to go up as the semester comes about. But we will also be practicing our safeguards for wearing our mask indoors at all times. But keep in mind that the increase is to be expected, although we are going to do everything we can in terms of encouraging safeguards to make certain it doesn't get any higher than it needs to be. Next slide. And to give you a comparison of last year, of course, school started at a little bit different time period when we started tracking. So this is something that we expect fully to happen again. We are preparing accordingly, making certain that we have isolation and quarantine protocols and places for the students to reside. And Dr. Glover, unfortunately, has become very well versed in this in the last 17 months and handles this process about as comprehensively and efficiently as can be humanly managed. And I'll pass it on to you, Dr. Glover.
Well, thank you all for joining us today. What you're looking at here on this slide is some local healthcare data. So we do communicate regularly, almost daily, with our healthcare partners here in the Charleston area, because in addition, to being in touch with the health of our students on campus and our employees on campus, we want to ensure that the healthcare infrastructure in Charleston, remains intact. So current models from our healthcare partners project admission rates related to COVID-19 to continue to increase. Unfortunately, those models do suggest a 30 to 40% increase in admissions over what we saw about a year ago in July of 2020. So that in part, has influenced our decision-making in terms of mitigating risk in the ways that make the most sense for our CSU community. So at this point, I kind of just want to walk you through some of our plans for the fall 2021 semester. And I'm going to focus on those that will affect the students most profoundly. Returning students are going to be familiar with virtually all of these plans because they look very similar to some of the things that we enacted last year. But our newer students, this may be new for, so you guys are welcome to ask any questions in the chat. And if we don't address those throughout our presentation, then we will have a question and answer time at the end where we can answer anything else that may come to mind for you. So our plans include symptom screening, physical distancing, masking, virtual accommodations where appropriate. We've had to make some modifications to on-campus life, and then we do continue to encourage vaccination for those that are able to be vaccinated. Now, we also have put in place an indoor mask mandate, and that is due to the CDC recommendation that fully vaccinated and unvaccinated people should wear a mask in public indoor settings in areas experiencing substantial or high COVID-19 transmission. Charleston Southern University is in Charleston County, which is experiencing a high level of COVID-19 transmission, and the surrounding counties to CSU are also unfortunately experiencing high rates of COVID-19 transmission. As we learned from Dr. Scheib, we know that the Delta variant is more contagious. We know that unvaccinated individuals are at higher risk, including children who are unable to be vaccinated. And we know that local outbreaks of disease are likely. Our focus is to use the tools that are available to us to minimize risk to our community while continuing to deliver a Christian education. Symptom screening last year utilized a smartphone application called BUCSAFE, and that application does continue to be available to our students as a way to get in touch with me if they're experiencing any symptom potentially attributable to COVID-19. So by entering any of our on-campus facilities, including the classroom, essentially our employees and our students are attesting to the fact that they are not currently experiencing a symptom that is potentially attributable to COVID-19, nor have they been exposed to COVID-19 to their knowledge. If they're experiencing symptoms or if they have been exposed, there are many ways that students and employees can get in touch with me to determine their next steps. One such way is to screen via the LiveSafe application, but they can also email me directly. They can call my office. We also have a COVID-19 email address that allows students to get in touch with me if they have questions or if they're concerned about symptoms that they are experiencing, particularly because the symptoms associated with COVID-19 are so wide-ranging. Academics, we are doing our best not to affect too profoundly. We do have a policy that addresses excessive absences. This was a policy that was in place pre-pandemic, and it has been modified for our fall 2021 semester. Students that are enrolled in on-campus classes that are being held in person, if they are prevented from attending class due to a COVID-19 related quarantine or isolation, they will not be counted absent for those days. Now, quarantine, as a reminder, is used for someone who has been exposed to COVID-19 but is not actively ill. Isolation is used for individuals who are experiencing symptoms or have a confirmed positive case of COVID-19. We do put the responsibility on the student, however, to supply their professor with proof of their quarantine or isolation status. That comes from my office. So it means that the student has to be communicative regarding their symptoms or their status. And as long as they are initiating that communication, responding to follow-up communication, again, absences related to COVID-19 will not affect their failure for non-attendance or that failure for non-attendance policy. Again, students have to report those symptoms or exposure, and there is language pertaining to that in every syllabus that will be distributed this semester. When we look at housing and dining, one of the most frequent questions I've seen is, do I have to submit a negative COVID test before I move in? Most of our students move in this weekend. No, you do not have to submit a negative test. You do not have to submit proof of vaccination to move in this weekend. However, if you know you've been exposed or you're experiencing symptoms that potentially could be attributable to COVID-19, I would ask that you reach out to me now so that we can determine if we need to make alternate plans for you. We do not require that our students or our employees be vaccinated against COVID-19. We do highly encourage vaccination to protect the health and safety of everyone on our campus. Now, we do have some housing available for students who have been exposed or who become ill throughout the semester, but it is very limited. It is also shared space. So students will not necessarily have a private room to isolate or to quarantine in. Because of that, it is my strong recommendation that if you are a student, you work now. If you are a parent, you discuss with your student now, what is your plan in the event that your student is affected by quarantine and or isolation? Are they able to return home? If they don't have a vehicle, are you able to retrieve them from campus so that they can isolate or quarantine at home for their own comfort? So again, while we do have some housing on campus, it is very limited, and almost all students are far more comfortable if they're able to quarantine or to isolate in their own home. The dining hall continues to be available. Our students can dine in the dining hall, and there also are some grab and go options. Student life is what we'll look at next. So all of our Charleston Southern University students have to have chapel credits. They have a certain number that they have to obtain for each semester of full-time enrollment. This semester, our plan is to have both in-person and virtual options for chapel. So if we have a student that is uncomfortable attending an indoor chapel with a large number of attendees, they do have a virtual option, so they'll be able to obtain those credits without being physically present in the chapel. Student life activities that are outdoor will not have capacity limitations at this time. And the Brewer Center, which is our pool and our gym, continues to be open with very slightly limited capacity. There is distancing, masking in effect, and some enhanced disinfection practices. Student health services are offered on our campus by Fetter Health Network, which is our healthcare partner. So Fetter is on campus with their mobile medical unit at least once weekly, and Fetter does have the ability to test students for COVID-19 when they're on campus. Students can also be seen at one of the many Fetter locations off campus throughout the week. In addition, we do currently have a DHEC COVID-19 testing site available to students on our campus. It's a free testing site that does not require an appointment. And we are hopeful that we'll continue to be able to partner with DHEC throughout the fall semester to offer that service to our students and to our employees. We're also hopeful that Fetter will have the capability to administer the COVID-19 vaccine to interested students or employees during their time on campus. I'm going to transition a bit into looking at some of the more frequently asked questions that we have seen in our communication with students and with parents. And the first one is the attendance policy, which I've addressed a little bit already. But students that are enrolled in on-campus classes, they do have the option to request permission to complete their course requirements from a remote location. We refer to this often as virtual attendance. And they have the option to request permission to do that if there are documented personal medical issues or documented family medical issues. So there is an application process, and documentation from a healthcare provider is required to accompany an application for virtual learning. And this is a departure from the policy that we used last year. Now, if this virtual learning accommodation is granted, the student is accepting responsibility for accessing all of their materials online and completing all of their assignments remotely in a timely manner for the whole semester. So if we have students that wish to apply for that, if they are applying due to a personal medical condition, they'll do so via our Student Success Center. Again, there's an application form, and they also need to provide documentation from their physician and submit that to the Student Success Center. If a student is applying for a virtual accommodation due to a family member concern, then those applications and supporting documentation will come to my office. So right now, students should be able to log on to Blackboard, which is our virtual learning platform, and they should see there the application and additional information about that virtual learning policy. You're also welcome to reach out to me directly with questions regarding that. Now, I do want to note that while this is available for many of our majors, students that are enrolled in clinical courses, including nursing, our physician assistant program, our athletic training programs, as well as students who are enrolled in lab sciences. So this is chemistry, physics, biology, and that's by no means all inclusive. Any lab sciences, including the lecture portion for the lab science, and students that are enrolled in practicum courses for education majors are not eligible for virtual accommodations at this time. In addition, if a student opts to apply for a virtual accommodation, they must attend all of their classes virtually, meaning they can't attend one class in person and then ask for a virtual accommodation for other classes. Lastly, student athletes that are actively participating in practices are unable to apply for a virtual accommodation. And if a student is applying for this type of accommodation, the expectation would be that they're not attending other events in person on campus. All right, some more frequently asked questions as we move to the next slide. First question, where do I need to wear a mask? Essentially, anytime you're indoors, we're asking that you remain masked. So that's going to include all of our indoor locations on the CSU campus and indoor locations at CSU sponsored events if they are off campus. Now, if we have a student, a faculty, or a staff member that is positive for COVID-19, their first stop is an interview with me where I'll walk them through Their return to campus process. I'll walk through any close contacts that may need to quarantine because of close contact with someone who then went on to test positive. So all of that is handled on a case-by-case basis because everybody is a little bit different and every exposure and every illness is a little bit different. But in all cases, I do apply the same consistent CDC guidelines for quarantine and isolation. Another question that we got is, well, what happens if the healthcare system in Charleston is overwhelmed? The reason that we continue to be in communication so frequently with our healthcare partners is, one, because we want to protect the health of our students. If they need emergency medical services, we want to ensure that they're able to access those. And two, we want to protect the healthcare infrastructure in Charleston. So we will continue to monitor several different metrics that allow the assessment of hospital capacity in Charleston. And if those metrics indicate that it's unsafe for us to continue to be here in person, then at that time, should we cross that bridge, we would make a recommendation to enact any changes necessary. Proof of a negative test before move-in is not required, nor is the COVID-19 vaccine. The next slide has some additional frequently asked questions, some of which we've touched on already. If a student is sick or exposed, can they stay on campus? Again, we have space, but it is very limited. So unless there are some sort of extreme extenuating circumstances, we really and truly recommend that you create an off-campus quarantine or isolation plan for the fall semester. We will offer student life events in the fall semester. We will have to continue to be flexible and respond to infection rates in Charleston and on our campus, most importantly. So if the COVID-19 situation changes, then events may have to change as well. That could be beneficial to us if the COVID-19 situation improves. Well, we may be in a situation where we can offer more indoor events. But unfortunately, if the situation deteriorates, then there always is a possibility that we have to roll back or postpone or adjust events. Chapel, we addressed. Virtual accommodations, again, nursing, all lab sciences, all clinical courses, education, practicum courses. These are all courses or programs that have challenges operating in a virtual environment where we just can't meet the learning outcomes without being there physically in person. So unfortunately, those courses are unable to offer virtual learning accommodations. We will have tutoring available virtually and in person. Our counseling center is open and we'll see students both virtually and in person, as will all of the many other student services we have here on campus. So at this time, we're going to transition to the Q&A portion of our town hall today. So I'll kind of take a look and see if there's anything that Dr. Scheib or Dr. Costin or I can address.
Dr. Glover, before you look in the Q&A box, we did have a few private messages. One of them says, will quarantine isolation be different for vaccinated versus unvaccinated students? Could you answer that?
Yes. So, originally, if you got vaccinated and you were exposed, we didn't need to do any follow-up testing or follow-up care. And unfortunately, Delta came on the scene and she's been kind of a pain in our behinds, and we've had to pivot a bit. So because of that, we do have new guidelines from the CDC. So if you are fully vaccinated and we have a case of exposure, the recommendation is that you would mask in all public areas, and then you would test 3 days after your exposure occurred. If that test result is negative, then you're immediately cleared. So that is a much, much shorter process for a vaccinated individual than for a non-vaccinated individual. In the case of a non-vaccinated person being exposed, they would wait until 5 days after exposure to test. And then on day 7, if their test result was negative and they had not developed any symptoms, then they would be released from quarantine. And again, quarantine is due to exposure to COVID-19. If you're quarantined, you're not sick. You've been exposed. So we're limiting your movement because we know that pre-symptomatic transmission of COVID occurs, and we want to avoid creating additional cases should you become ill. All right. So let me take a peek at some of our other questions. Okay, I see the first question here, with the wide range of symptoms reported with Delta, do I need to report every time I have a stuffy nose? It's a great question because when we look at COVID symptoms pre-Delta, when we look at COVID symptoms, it's everything from stuffy nose, scratchy throat, congestion, nausea, diarrhea, fatigue. I don't know a college student, especially when we get to midterm and finals week, that's not fatigue. So what I like to do is sort of add another clarifying word in front of that: unusual fatigue. So something that's outside of the norm for you. Unusual headache. Again, I drink a lot of coffee. If I don't drink my coffee in the morning, I'm gonna have a headache and I'm still gonna come to work because that's not an unusual symptom for me. So you can use some common sense when we're looking at your symptoms. If you have a previous diagnosis of seasonal allergies that you are under the care of a physician for, and the symptoms you're experiencing are completely in line with what you experience year after year after year, then you can use your common sense in terms of whether you need to take any additional steps. If there is any question, however, any concern that, hey, maybe I'm sick, even if you don't think it's COVID, I would ask you to reach out. We desperately want to remain open and to remain in person for classes. And our best chance at achieving that milestone is if we, really carefully vet every potential case. So if there's ever a concern and you're just not sure, it's always better to err on the side of caution and reach out, and we'll determine the most appropriate next steps for you. Quarantine requirements for a student with natural immunity who is exposed. That's a great question as well. So if you have tested positive for COVID-19 in the previous 90 days, you do not need to quarantine following exposure. So if you are someone who fairly recently battled COVID and completed an isolation, it is a good idea for you to either take a picture of your test, make sure your name is showing and the date, the testing date is showing, or to bring that physical test with you so that you'll have that documentation in the event that you are exposed. Let's see. Isolation for a vaccinated person. Let me answer that live. So isolation, again, is someone who's symptomatic or has tested positive. So the length of time for isolation does not vary based on vaccination status. If you are infected with the virus, you do 10-day isolation, whether you are vaccinated or not. Now, you are less likely to become infected if you're vaccinated. And in the event you do become infected, your symptoms are likely to be very mild, and you have a much lower risk of complications, hospitalization, and death from the virus. But the isolation period itself does not change based on vaccination status. So exposure procedures, you guys have actually really great questions. Does the quarantine or the exposure procedure apply to a partially vaccinated individual, meaning you've had one dose of a 2-dose vaccine series, you're between doses of Pfizer or Moderna? So vaccination does not affect the quarantine protocol until you reach that fully vaccinated status. So if you've had only one dose of a vaccine, then essentially we'll treat an exposure like you're not vaccinated. Similarly, let's say I got my second dose yesterday and I'm exposed today. I'm actually still not considered fully vaccinated. Fully vaccinated status means that 2 weeks have passed since my second dose in a 2-dose series. If you're someone who got the Janssen vaccine, Johnson & Johnson, then that would be 2 weeks from the 1 dose of that particular vaccine product. Will an exposed person be allowed to quarantine in his or her dorm room, or will they be asked to quarantine someplace else? So another good question that really is dependent upon the circumstance. So if you are in a suite, we have suites on campus, so you have 2 rooms and they share a bathroom. So typically there are 2 people that live in each room. If all 4 of those people were exposed together. Maybe they went out to dinner with some other people. They went to a social event. They were all exposed together. Yes, they can all stay in their own dorm room and they can quarantine in their own dorm room. If you were exposed, but your roommate wasn't, or your suite mates were not, and they are not quarantining, then you are unable to quarantine in your dorm room because of the risk of pre-symptomatic transmission. We want to protect your roommate and your suite mates from exposure. Let's see. Okay, a question regarding a roommate for the fall semester is currently battling COVID. So she is having to postpone her move-in date, and there's concern about family transmission. So any student that has had to delay their move-in date should have been or will be in contact with me. And as a part of the instruction that they receive, we'll ask that family members that haven't also completed a quarantine or an isolation process not come to campus, due specifically to the risks that you are concerned about. We do not plan to mandate the COVID-19 vaccine. It is not required now. It is encouraged, but not required, and CSU does not have plans to mandate a vaccine. See. I apologize, I'm kind of catching up, scrolling. Type of masks, what types of masks are required? So we do not allow gator style masks because they don't offer equivalent protection. So the type of mask that we ask you to wear is a double layered, either reusable or disposable mask that fully covers the mouth and the nose and attaches behind the head. So the easiest, the simplest kind is that which loops over your ears. Is it possible the whole campus will shut down and all students will be sent home? I sure hope not. Our number one goal is for everyone to stay healthy and safe. That being said, I think Dr. Costin can attest to the fact that we're extremely realistic in our assessment of the community surrounding us and what the infection risks look like on campus. So, if we were in a situation where we felt it was unsafe for our employees or for our students to remain on campus, or unsafe for them to continue attending classes in person, then we would consider all available options. But that would certainly be, a last resort for us to completely close down campus and send all of our students home. Okay, this is a great question. So people who had COVID previously, maybe you had COVID last school year, last academic year, you're not vaccinated, but you did have COVID. How are they treated in terms of quarantine following an exposure? So if you have not had a positive test and completed isolation in the past 90 days, we would still ask you to quarantine following exposure. And that's because from individual to individual, our immune response varies somewhat in terms of how robust and how long lasting it is. So the data that we have available suggests that, up until that 90-day point after infection, you have really good protection against being infected again. But after that 90-day point, that's when we start to see that protection start to wane some in many individuals. Okay, so request for virtual instruction. So our virtual accommodation is different from the ability to attend virtually because you're affected by quarantine and isolation. You don't have to provide, specific healthcare or health provider created letter, and you don't have to submit a form of application if you are affected by quarantine or isolation. You just have to communicate with me, and I provide documentation that says, you will be affected by quarantine until this day, or you will be affected by isolation until this day. You provide that to your professor, and during that time, any absences are not counted against you. See. Another question about, returning home with our limited quarantine and isolation space. And this is a legitimate concern. If you live with someone who is immunocompromised, perhaps is high risk for infection, you may be very hesitant to return home in those situations. And we'll do everything that we can to accommodate you on campus should that apply in your situation. How would a quarantine period work for classes? So again, after we know that you have been exposed, I would date your quarantine based on whether or not you were vaccinated. If you're vaccinated, it's a period really of just 3 days after your exposure. If you're not vaccinated, it's a week. So during that time, your professor will record all lectures in class. They'll do that via Zoom, but many professors will opt to record audio only versus audio and video. And then they will provide that link to the recording from class to you after class has completed. And they'll do that for the amount of time you're in quarantine or isolation. Office hours in person versus virtually is going to vary based on the professor and their individual office space. If they have an office space that allows them to distance, they may opt to hold office hours masked and in person. I've also encouraged a lot of professors to really kind of think outside of the box, and you can support them as students in doing that. If you really feel like you need that one-on-one time with your professor, there really is no reason why we can't meet with a student outside, or we can't meet with a student in the classroom after class. Classrooms are bigger. They allow us to distance more effectively. So if you really are craving that in-person advisement from one of your professors, I would just encourage you to let them know that, and then we can sort of think about ways to make that happen.
I just want to say really to Dr. Glover, Rebecca had a question in the chat. I just want to make sure that you saw that. I think that's to be answered privately, but I wanted to make sure that if for some reason you don't get to Rebecca this way, Rebecca, you can get a hold of Dr. Glover via the COVID-19 email. So don't want you to miss, because it's an important question.
Yeah, Rebecca, do me a favor, email me those COVID-19 emails. They come straight to me, and I'll respond to you after we finish up the town hall. Okay. Let's see.
There's also a question in there, Dr. Glover, and the question the question says, does Dr. Glover treat the student with ivermectin or hydroxychloroquine? I would just point out that what we would do, and I'm a doctor but not a physician, what we would do is refer you to your healthcare provider, who will then advise on treatment. So we don't provide treatment here, just to clarify that point.
Now, you can seek treatment virtually, even through telemedicine with Fetter Healthcare, which is our healthcare partner. So even our students that are in quarantine and isolation, whether they're on campus or they've returned home, they can see a provider virtually should they need to. And every student that's affected by quarantine or isolation does receive instructions from me on how to access that type of service if they need to see a healthcare provider.
And I think, again, you can correct me where I'm wrong here, Dr. Glover, but if in fact the student were to stay on campus and wanted to contact their family provider back at home, they could still do that, right?
Absolutely, absolutely. They're by no means obligated to seek treatment through Fetter. You can seek treatment wherever you choose. We just want to, facilitate any means for you to get an exam if that's warranted, if that's needed. Let's see, Lori asked, is it possible to have parent representation and student representation on the COVID task force? Dr. Scheip and I have actually sort of liaised, perhaps is not the right word, but our Student Government Association and our student body president are in communication with us frequently. And our student body president did attend last year one of the subcommittees of our pandemic task force every other week. We do not have parent representation on the COVID task force at this time and don't currently have any plans to incorporate parents formally to that process. However, you are always able to reach out via the email address that you see there if you have questions or concerns. Sometimes it's a little bit tricky because we do have to remember that your students, when they come to college, are adults. So if they're over the age of 18, really what we are and are not allowed to talk about, that line can get a little blurry. And I understand this as a parent of a college student who attends CSU. So what I would ask is for you to have your student reach out if you have questions where you're not sure if we can answer it because of those guidelines with them being adults. If cases get worse, is there's a possibility to keep classes going but not allow students access off campus? So one of the slides that Dr. Scheip showed you looked at fall of 2020. We saw a significant spike when students came back from the summer break. And actually for a period of time in 2 weeks, we paused on-campus events for 2 weeks because we needed to get a handle on that infection or on our infection rates. And that is absolutely a step we would take again if it is warranted versus closing our campus. Again, I just want to stress if it's warranted.
Yeah, and I would just add really to that point that what we do, we meet on a weekly basis, and for most of the last year we met twice a week. And what we do is what I would describe as a conditions-based approach. And so we don't want to go overboard by being too restrictive, but at the same time, we keep in mind this balance of health and safety with accomplishing the mission. And so what's the question that we're always asking ourselves is, what's the best way to balance these two things? And so is it possible that we would cancel classes and send everybody home? Yeah, it's possible, but it is, as Dr. Glover said, that's the very last resort. And we have no intention of getting to that point, because what we hope happens is that we take other measures along the way so that let's say there is a spike that we think is overly concerning. We don't want to send people back home. Maybe they stay here. Maybe we go virtual classes for a couple of weeks. So all of this stuff is on the table, but our goal all along the way is to make sure that we accomplish the mission that God has given us to do, so that you can have the kind of experience that that you want here.
I see a question about football games. Football's outside. Outside minimizes risk significantly. So I'm actually super excited that I think we'll see football games this year. That's not something we got to do as much last year, I think, as we would like. But I would anticipate you will get to attend some football games for sure. If you are interested in an online accommodation, like I discussed, first I would suggest that you log on to Blackboard, look in your courses, because, for example, I have already posted the form and the instructions for applying for an online accommodation in all of my in-person courses. If that is problematic, or if you're having trouble navigating that, you're also welcome to email the COVID-19 address, and I will respond with the forms and instructions for you. Our protocol for professors, for staff, for any employee of CSU that is affected by COVID is the same as our protocol for students. We don't treat our employees any differently than our students when it comes to exposure or active illness. So, you know, it is fairly likely that students at some point in time will have a professor that is placed in quarantine or is completing an isolation. And how the professor chooses to deliver their class materials will largely be determined by their academic area and by the material that they are teaching. So they may choose to record lectures and post those on Blackboard. They may have a synchronous Zoom meeting like we're doing right now. We meet with our faculty tomorrow to have an info session, you know, similar to this for them. And just like I'm encouraging y'all to make plans for quarantine and isolation now, we will do the same with faculty. They need to have a plan ahead of time and communicate that to students. What will happen in the event I am exposed or I am ill, and how will you get your learning materials? So I encourage your student, I don't know, Eve, if you're a student or a parent, but if you're a student, I'd encourage you to ask your professor, hey, what's your plan? If you're quarantined or isolated, how will we access class materials?
Dr. Glover, we've nearly answered almost all questions. We're also approaching the 5 o'clock hour. So I want to be cognizant of everyone's time. And I know that we'll follow up with the FAQs. Anything that we didn't answer, we're happy to include in those FAQs. And we can send those out after the call, more than likely tomorrow. It'll give us a little bit of time to pull it all together.
Yeah, and I would just say as we close, again, thank you for being here. Again, this is recorded, and so we're going to make this available. Let me emphasize that from the very beginning until this thing is done with, all right? And so we're probably going into our, 18 month of this now. Our intention is to be extremely transparent. You know, we have nothing to hide. You know, we're trying to do the best that we can do, following the guidance that's available, making the best possible decisions for everyone. And trust me when I tell you, it's a different calculus if you're having to make a decision for the health and safety of one individual whom you love dearly, and you should be doing that, and so should they, as opposed to making decisions for the best interest of all 4,000 people who are here, faculty, staff, students, and aware that all of them have family members. And so I would ask you to pray for us. You know, we don't spend a lot of time watching the news. You know, we don't make decisions based on politics or any of that. We're just trying to follow the best possible guidance we can find, and do it the best way possible so that we can, again, balance health and safety with the mission that we've been asked to accomplish. And so I'd ask you again to pray for us along the way. This isn't the end. This might be the end of this hour, but this isn't the end. The COVID-19 email address is available, and we'll add to the frequently asked questions based on how frequently they're asked. And so if you have a question, you know, don't hesitate to ask it. And what I would encourage you to do is, because this is true, is that you would, if a policy comes out or a protocol comes out, I would just ask you that your first reaction would be, okay, I don't like it, maybe, I don't love it, may not agree with it. But what I do know is that these people love me, and they're doing the best that they can for as many people as possible. That's what we would ask you to do. You know, the psalmist says very well, when he asked the rhetorical question, where does my help come from? And he answers it immediately by saying, my help comes from the Lord, the maker of heaven and earth. And so we are a Christian university, and we mean that. We're not just Christian in name only. We really believe that God is sovereign and that Jesus Christ is his only son, and that we're empowered by the Spirit. We do believe that he's not given us a spirit of fear, but a spirit of love and faith and of a sound mind and of discipline. And we try to apply these principles as we make these decisions. I love the old VeggieTales episode and the song that came with it. I think of it often God is bigger than the boogeyman. He's bigger than Godzilla and the monsters on TV. We also believe with absolute confidence that he is bigger than this pandemic. He's bigger than COVID-19. He was bigger than the original variant. He's bigger than the Delta variant. And we pray that there is no, we pray that the variants don't work their way through the Greek alphabet. You know, we are ready for this thing to be over with. But in the meantime, you know, we are doing what we can to keep everybody safe, healthy, and on task and on target. And so God bless all of you for what you're doing. We look forward to seeing you on campus. It's going to be a very exciting year. And when there will come a time, I predict this semester, in just a few weeks, we hope, Lord willing, that we'll get to mask optional. And but along the way, we'll do what we think is best for the health and safety of our community. So God bless you as you go. Have a great rest of the week. Move-in day is just a couple days from now. And so look forward to that. And classes start on Monday. So as we sometimes say around here, giddy up, here we go. Bless y'all.